So you come home and your dog's leg is really swollen. What are you going to do? What do you look for? This leg swelled up really fast, and the owner came in that night to find it swollen about twice its size. Well, if your dog's putting weight on it, like this dog is doing, and the swelling came up rapidly and it doesn't seem to be hurting it and you can't find crusts or wounds, then you can probably give it some Benadryl and aspirin. If you were to look, especially in this area, there's just lots of fluid. If you came out and your dog's leg was like that, swollen all up and down, and the swelling ends here, it just kind of continues on down there. You'd start by checking the toes for any fractures and cuts and wounds. And this is the type of swelling that you get with a snake bite or a bug bite. So you check the whole leg for crusts or wounds, because could also be a very infected leg. So because look at how when I push in, it really dents, and then the normal leg like this here, you can feel the bone right. You can feel the bone right under the skin. This one's fat. So could it be pus? Yes. Can it just be fluid from an inflammatory response to a sting? Yes. So what we usually do is we check each part of the leg, the toes, the nails, the hop joint, the knee joint, and then the bones. And actually you'd watch your dog. If your dog's walking on the leg, then it means it's not broken. If it's putting weight down, it's not broken. But you think, okay, it could be an infection, or it could be a snake bite or a bug bite, are the most common things. So what we do is we give an injection of cortisone, and you can use Benadryl at home. You can use 1 milligram per pound of Benadryl and maybe some aspirin. If you come out that night before and it's like this, just use 1 milligram per pound Benadryl, some aspirin, and then get it checked up the next day. But at least you're on the road. And then if it's not as swollen the next day, then you can go, well, maybe I'll just wait. But that's something you can do. And also you'll feel hot. It's hot. So what we do is we're going to give a shot of antibiotics too. Mainly, not that maybe the dog absolutely needs antibiotics, because it probably is more of an inflammatory response, but I feel like if something's really swollen like that, what if I missed a little tiny wound there? Or what if it gets infected after the allergic reaction occurs? So I'm going to give a shot just to be safe. And this is Polyflex. It's an ampicillin type product. It can go under the skin. So when you give a dog a shot, you can, I usually pinch the skin like that. And this is a little cold, and sometimes they feel it like that. And sometimes they feel it going in. But anyway, that's what we call a sub-Q shot. And that'll cover the antibiotics. Will cover if it's infected right now. And then the anti-inflammatory is cortisone, and I gave that, and then I'll give pills to go home as far as a antibiotic, and then also give anti-inflammatories to go home, and that will be prednisone until the leg's better. And then if the leg doesn't get better, we can x-ray it, we can take a sample of the fluid and make sure it's not pus, or it's due to any other bad infection. But anyway, I thought you might like to see that. So if you come out and your dog has a swollen face, swollen leg, swelling and hives on its sides, then it probably has an allergic reaction. A lot of dogs bite bees and get swelling in their face and their lips and the sides of their face, and that can be an allergic reaction. So you can give them Benadryl at 1 milligram per pound without the decongestant in it. No pseudoephedrine. You don't want them to get jumpy. and it can harm little dogs. So about 1 milligram per pound of Benadryl really works out. You can also use aspirin at 5 milligrams per pound, and usually you use a low dose aspirin for little dogs and the higher dose adult aspirin, the 325 milligrams, for bigger dogs. And you never want to go over a couple aspirin in a dog. Usually I use 1 aspirin to 2 aspirins in a real big dog, even though at 5 milligrams per pound you could give them more. Anyway, you can always do that. The swelling can always be caused from an infection, a tick bite causing an infection in the leg, wounds, cat bites can cause infections in the legs, little stickers can cause infections in the paws that go up the legs. Those are really common problems. If you took your dog's temperature and its temperature is 103, then you'd know that maybe it has an infection and you ought to get it checked out for antibiotics. If your dog just has a swollen face or swollen gums and hives on its sides, or a swollen leg like this dog, and you give it Benadryl and aspirin, and it goes down and the dog looks completely normal, walking on the leg really good, eating good, the swelling all goes down, then that's a great thing. And you probably cured it, but you should always get your dog checked out, or your cat, just to make sure. I gave cortisone to this dog, and I just wanted to clear that up. You could give Benadryl and aspirin and probably be fine in this dog, but this was a really enlarged leg and really swollen, and I wanted to give cortisone. Dexamethasone is great for allergic reactions, so I give that a lot, and then I give prednisone to go home for a few days. Once a day for a few days, and then every other day, and that helps with the allergic reaction. And the reason why I use antibiotics is because that leg was so swollen. I don't usually see him that swollen, and wanted to make sure that I wasn't missing an infection that was going on. So I did administer antibiotics and then send home a prescription for about a week. But anyway, hope you enjoyed the video. I like to make just kind of routine things I see every day. If you get a chance, visit my website, Dog Dish Diet. If you want to cook for your dog or cat, look at the book, Feed Your Pet to Avoid the Vet. I really do think healthy ingredients are the ball game for a lot of animals. You feed them healthier ingredients, and their skin's going to look better, as their ear infections might clear up, bladder infections might get better, dogs may not have the seizures may be a lot less in severity or even go away. So those are all things I've seen by feeding animals healthy ingredients. So check out dogdishdiet.com, dogdishdiet.com if you get a chance. Have a great day.